And how's everybody? Always be careful of who you follow. Now, that's a tough act to follow. So you'll have to bear with me, okay? And I do thank you, Dr. Everest Manley, for that wonderful introduction. And I'm truly humble, and that's just a little joke we'll get to later. And I also want to thank you and your esteemed faculty for inviting me to speak to you today about a topic that is dear to my heart, which is communication. I consider communication as one of the basic tenets of nursing, for how can you care for someone if you don't really understand that person or persons? I became interested in communication during my early years of nursing when I noted that what one person said was not necessarily what another person heard or acted upon. Okay, we're talking about messages, okay? A basic example, and my mother was a storyteller. She was from South Carolina, okay? And so that's the way they communicated and the way we passed down our history. So I'm going to tell stories today, okay? And I think at this age I can tell stories. Okay. Okay, a basic example of what I just said about what somebody said is not necessarily what another person hears. Okay. While I was teaching at Lewis University, which is a small Catholic school in Illinois, in the middle 70s, and I have a smiley face after that, okay, 70s, I heard one of the faculty members complaining that one of her advisees had missed her appointment, which had been scheduled for that morning. Okay, later that same afternoon, because my office was in the front of the building, a black student came into my office, and she was very upset, and because her professor was not in her office for the scheduled appointment. Now, I might add that the instructor was very upset, and that she was calling the student very undependable, et cetera. Whereas the student was upset and on the verge of tears because she thought she had missed an appointment. Okay, I tracked the instructor down, and I asked her, I explained that the student had misunderstood the message, and would she make time to see the student, which she said she couldn't do. I tell you this story to make you aware, okay, which you probably already are, that communication can be deliberately misleading, okay, to accomplish other agendas. Okay. For example, a white instructor setting up a black student. And there were very few black students in white institutions at that time, just as there were very few faculty members. And black students were under intense pressure. And I know none of you students understand that, right? Okay? And to be fair, the intense pressure might have been interfered, it might have interfered with the black student hearing and processing the discussion of time with the student. So you really have to look at several angles when you're dealing with communication, okay? Students are stressed out, okay? So they might not have heard what the faculty, I do want to be fair. But my personal feeling at that time was that the instructor was setting the student up for failure. I'm sure that all of you are intelligent enough to understand that there is a major flaw in this recollection, okay? You have the storyteller now interpreting messages, right? Okay, so you got me saying that this is really wrong. Okay. Being one of only 2 black nursing faculty members at that particular school, I might have some problems with the scenario based on my past experiences in teaching nursing. So to be fair, you should attempt to look at a situation from many angles to arrive at a viable, honest solution. Okay, it's not just one thing or one person. You look at it because we live together. Okay. So communication is really hard work. It's not easy, so don't ever think it's easy, because the decisions you make from communication influence other activities and events. Okay, so we do want to remember that. When we recognize that communication is just not verbal, but also behavioral, one becomes cognizant of the wide scope of the concept. It is such an important concept that is usually taught in the first nursing course, and is usually included in almost every nursing course there is. At least when I was teaching, communication was a very, big concept. Since nursing has had a long affair, and I chuckle at this, with technology, and we do respect bells and whistles, don't we? So that's hard nursing, difficult nursing. And so communication is considered soft nursing. And so I was usually relegated to teaching the communication theory classes, Everybody else was going for the bells and whistles. Now, Webster has many definitions of communication, but the one I like best states that communication is a process by which information is exchanged between individuals through a common system of symbols, signs, or behavior. Okay, so this is what we'll be dealing with. Communication, therefore, is the foundation for all social roles in our lives. In our places of employment, it determines to a large extent how successful we become and how far we advance in our careers. On a basic level, all nursing programs require some theory of communication before you enter the nursing program. So it's really a basic concept in nursing. So we all know what nursing is. You know, I won't go through the thing. ANA has a great definition on their website, and all of you guys are computer literate. I see social media and all of that. Do you use social media here at Drew? Great. Twitter, Facebook, you know, all of those things? All right, okay. So in terms of important concepts of communication, I really like to look at the negative versus the positive. And so in this section, I'll sort of tell you some of the things that I have experienced. I had the privilege of sitting with Dr. Stella Robinson for breakfast this morning, and she really needs to write a book. I mean, she's a wealth of, I really want her to come up here, and when I stop, okay, Stella, you can give some more examples now. So she's really great. Negative versus positive communication. What might be negative for one person involved in a communication scenario might be viewed as a positive for another person in the same scenario. Okay, so for example, from a faculty perspective, writing a clinical evaluation on a student might be viewed as a positive method of encouraging the student to progress towards satisfactory completion of or meeting the goals of the course. The student, however, might view the evaluation experience as a negative experience and feel that the evaluation is a means used by the faculty member to fail her or him. Okay? Attempting to bring clarity to the situation can be a difficult task, but one that improves with experience. And from a faculty perspective, one must become cognizant of personal attitudes one might have towards persons of another ethnic or cultural background. Do you want me to say that again? Okay. From a faculty perspective, now this is the power perspective, okay? One must become cognizant of personal attitudes one might have towards persons of another ethnic or cultural background. This can only happen if faculty members are honest and admit that they might hold negative views of others. I'll make a little note here highlighted in yellow. In all my 50, don't laugh, plus years in academia, there must be a little respect for age. Okay? Not in all of my 50 plus years in academia have I ever heard a Caucasian faculty member admit that they might be prejudiced towards anyone. They are saints. Okay? But they're human. Don't forget that. But they are saints in their own eyesight. All right. So this is what we have to deal with. And I'm looking at it from a student perspective. But I'll get to the faculty perspective, too, because we don't have it easy here. Of course, I have to say, in a backtrack, I am certain that there are some faculty members who have done so, who admit that they have faults, and they might not be that positive towards certain students or other faculty members. I'm sure they are, and I say, may God bless you. Okay? But faculty members are also in a position of power, and power was one of my really research efforts. I really like studying power. It's an important concept and something that we really need to do more of. It rules the world, as you saw in Congress. Okay, they had the power. They shut the government down. Okay, they held us hostage. That's power. And it's in nursing, too. You just have to look around. But faculty members have the basic power in this situation. Okay. They have the major responsibility for ensuring, though, that communication between them and the student is honest and forthright and provided in a manner that the student feels a sincerity and honesty in the evaluation or communication atmosphere. That's their responsibility. They are working with students, okay? Now, from a student perspective, clarity of communication might be affected by prior experiences with this teacher or with another teacher. It might also be affected by language differences. For example, what is acceptable language, behavior, etc.? When I was teaching at the University of Illinois, I had students who came in with rings in their lips. or in their nose, just like this. And I'm saying, well, you can't do that, okay? But that's acceptable in that community, in that culture. We just say you can't bring it into this hospital. That's all we're saying. We're not saying it's good, bad, or indifferent. You cannot come to work like that. Okay, so there's just a differences in culture that we have to learn, what to do about. From a historical perspective, nursing is primarily a white, female-dominated profession. I don't see this changing in the next 50 years. We can say we're going to put you out, go to work. You're not going to dent the numbers of white female nurses that dominate the profession, okay? Americans have grappled with racism, prejudice, and civil rights issues for the past 50 to 60 years. I'm a 60s person in terms of that, in terms of civil rights. I lived through it, okay? And I could have Dr. Stella Robinson come up here too and tell her experiences, okay? Yet no one has ever acknowledged or been concerned about how nursing has remained steadfastly white and female. Males are coming into nursing, thank the Lord. They bring a different perspective, which is highly positive. I want to tell you all of you, okay? For one thing, they ask for more money. I like that. Isn't that true? Females come into nursing to provide a service, religious almost. Men come in, I'm not saying that's the only reason you come in there, don't get me wrong, but you want to be paid for what you know and do. Okay, so I'd say bring more men into nursing, all right? Okay. I can tell you how nursing has remained white and female dominated through the clinical evaluation system. We can get you. You can make A's in the classroom, but if you flunk clinical, what happens? You're out. You're out. They control clinical evaluations. Okay. There is an unspoken rule in nursing that no one enters the sacred hallowed grounds of nursing unless they possess certain qualities of character. Look at those nurses around you. Just take a look. What similar qualities do you all possess? You look alike. Look at yourselves. She looks just like her and her, okay? Don't you think you look alike? My daughter used to say when she was in high school, Mother, I can always tell when I meet a nurse, you all look alike. We talk alike, we look alike. Because people who don't look like us don't stay in nursing. We flunk them out. It's intentional. Nobody ever told you this, did they? Okay. The message here is that on entering any nursing program or entering any workplace, be cognizant of the communication behaviors of those around you. Recognize that there are people who wish to help you, and there will be those who wish that you had never been hired or admitted, and they will proceed to get you fired and kicked out. This is life in nursing and academia. This is it. Even when you go to grad school, it's the same thing, okay? This brings to mind a saying I first heard in Wisconsin, which she mentioned here. Anybody from Wisconsin? Anybody from Wisconsin? Okay. And I'm sure you've heard, nurses eat their own, okay? And I thought it was a terrible thing when I first heard it. I really didn't understand the meaning of the concept, but after much cogitation, it dawned on me what it meant. Nurses are the hardest on each other. To work with a nurse who was easy? No. We take reporting you very seriously. Doctors might get away with, doing things, but not nurses. A nurse can smile at you, look at you. If you do it, they report you to state board. You will lose your license. That's what they do, and I think that's what we should do, really. Or what we really should do is take you aside and say, you're not doing this properly. This is really the best way to do this before we kick you out. Okay, that's communication too. Knowing the history of nursing, and I always love nursing history, will give you some insights into how the profession operates to protect itself and the community client it serves. So there's a definite need for clarity in all communication. Clarity will put some of the power back in your hands. For example, if you recognize that a teacher is not grading you on a fair basis, you have several options. Use the clinical evaluation form to better improve your preparation for the clinical area. Assume that the teacher is giving you good, valid help, information. Then you take this, you become better prepared when you come into the clinical area. You just don't say, well, I didn't have time to prepare to take care of this patient. That's not acceptable. Okay. Two, the second option is that you can have a dialogue with the teacher and use your communication skills that you have learned in school and say, I feel that there is a disconnect between what you write in my evaluation report and what I feel that I have achieved. And then don't you like that I feel that? Then you hand them the proof. You know, this is what I have prepared, and this is what I have done for my clients, my patients. Now, if that doesn't work, you can request a transfer to another clinical group, and you know who's going to laugh in your face, right? But you can always request it. What you've done, you put that faculty member on notice that you don't think she's being fair to you. What you really want to do is to stay in this nursing program, don't you? You want to graduate, all right? Now, if all else fails, make an appointment to see the department head or the chair of your department and tell her your concerns. All schools of nursing have student handbooks that you are given on admission. I don't know how many of you read it and whether you ever open it, but you should know it from cover to cover. You know, it's like your little Bible. If they don't do this, then you go see the dean. Or you go over this. She doesn't do anything, you go over the dean. There's a provost here. And they would just love to see you because I know they don't have enough work to do. Right. Right. Okay. I do not wish to imply that only minority students have communication problems in nursing programs. I just feel that it's imperative that we graduate more minority nurses to care for our minority clients. That's my main concern. Diseases are ravaging our communities. Public health departments have almost folded or phased out. At least they're not providing the same level of care that they did 50 or 60 years ago. They just don't do it. And a lot of mental hospitals have shut down. So we're really in a crisis situation in terms of community health. Excuse me. This brings me to the point where I discuss my experiences in higher education, the good, the bad, and the ugly, all right? Let's say that all of you will graduate with high honors. That's what you shoot for. I never never got a C, all right? All right, graduate with high honors, didn't I, Chuck? Okay, yes. Okay, all of you are going to graduate with high honors, and 50% of you will decide that teaching is what you really, really want to do. Now, you see me really pushing teaching, don't you? All right, get a couple of years in the hospital, clinical area, then come back into teaching. We really need you, all right? Okay. I'm an optimistic person, but do you really know what you're getting into? I'm going to say 50% of you coming into teaching. Do you really know what you're going to get into? All right. Let's talk about historical necessity for communication, or isolation versus the revolving door. I have always been either the only black faculty member teaching in a school of nursing or only one of a few. However, there was always a feeling of isolation. You learn early that your viewpoints are not taken as seriously as those of your white peers. For me, having come from New York City and having taught in a diploma program in the Bronx at Morrisania City Hospital, I felt very confident in my clinical skills, okay? I remember moving from New York to Indiana, where I taught at Valparaiso University, I'll go ahead and say it, okay? And taking my maternal child students to the premature nursery, they call it the preemie nursery then. And one of the medical doctors complained to the nurses, charge nurse, that I had students in the preemie nursery. And so unbeknownst to me, she scoped me out, okay, and she told the doctor, well, she seemed to do everything that we do. I don't know what your problem is. So the doctor, well, I got a little upset when I heard this thing coming on. So I went to the doctor and I was livid, and I told him that if he wished to supervise anybody, and I hope there are no medical doctors in the room, I said if he wanted to supervise anybody, he should start his own medical school, because he wasn't qualified to supervise nursing students. I had a smart mouth. Okay, he went to my dean. This is communication, right? He went to my dean and told her what I said. The dean took me out of that hospital and put me over in East Chicago. So you look for, it didn't bother me. You look for repercussions if you're going to have a smart mouth. You got to look for repercussions. Though. Somebody always has more power than you. Okay. Okay, communication. What was the doctor saying to me? That as a black faculty member with a master's degree in nursing, I was not qualified to teach white nursing students? And what was the white nurse saying to me? That she actually had to see me practice before she could say that I was qualified to teach white students? And what did the dean say to me, who was the white dean? That I had to acquiesce to all clinical people, but especially medical doctors, if I wished to keep my job, which is what she said. These are all situations you will probably run into in your professional career. How you handle them will determine to a large degree your success in your chosen field. As a young faculty member, I was grappling with these and other issues with no support. There were no other black faculty members at Valparaiso. Okay. Nurses teaching in an institution of higher education must meet the same tenure and promotion guidelines as faculty in any other area of the university in which they teach. There is no, qualm, so everybody agrees to that. All accredited schools of nursing have detailed policies and procedures which are based on the university goals and objectives. It flows downward into each program, okay? These policies and procedures are given to all newly hired faculty members to use as a guide for advancement in their departments and to meet tenure and promotion guidelines. What you learn early is that no one is going to help you meet these guidelines. Did you understand that? You're on your own, okay? You can do it or you will leave. All right, so as long as you know that going in, you can survive. And the unwritten and unspoken rule is that you will be hired to meet minority quotas, and it goes for the men too. You're considered a minority in nursing. You'll be hired to meet minority quotas, and after 7 years, you will be kicked out the door. It's called the revolving door, which is a nice way to say it. And everybody in academia knows this. But new faculty members usually are unaware of what they're getting into. They're so impressed about being an assistant professor, okay, that they allow themselves to teach too many courses, serve on too many committees, advise too many students, okay? And that's serve on committees on and off campus, because in higher education you have to do community service. All right, so that the years roll on, and before you know it, it's year 6, and you have not published any articles, done any research, have not been funded for any research, have given no presentations, served on no editorial review boards, and you are frantic, okay? In essence, you have been used. It was purely intentional. You were not intended to stay after 7 years, okay? So you might be asking yourself the following question. Wasn't it the responsibility of the individual faculty member to review the faculty handbook to see what was required of him or her in order to meet tenure guidelines? Now that's a very mature question, isn't it? Okay? That's a good question. If newly hired faculty members were treated the same. Okay, you know what my next example is, don't you? When I taught at a large white university, and I've taught at several, I was one of 2 black faculty members hired. And then a white faculty member was also hired at the same time. So 2 black faculty members, 1 white faculty member in the same department. During the next 6 months, I noticed that the white faculty members was being mentored by another white faculty member, okay? She was helping to set up a professional journal, and she was doing research, etc. While the 2 black faculty members served on committees, served as advisors to the Black Student Union, etc. Okay? At the Christmas party given by the department, I made the mistake of asking the question, if you did not intend to help us, why did you hire us? The room got totally silent. Okay? Smart mouth again. Okay. So this shocked everybody, and of course from there I was persona non grata for the rest of the time I stayed there. And I was there for 4 long years, okay? The question needed to be asked. Communication between all should have taken place, but they shut down and shut me out. Not only that, but the department head told me that this is really, they had graduates all across the country in schools of nursing, and that my name would be mud across the United States. I have to tell this, so it's not written here, but I was voted into the American Academy of Nursing a few years after that. And when I went to be inducted, one of the faculty members of this large school looked at me and said, "What are you doing here?" That's the same thing you're doing here. It's really a small world, isn't it? You know? Okay. That was not the only infraction I was accused of, so I have to tell you the truth. I made the mistake of doing one of my first research projects on university stationery or letterhead. The title of the student study, which was the first one in the country, was How Minority Students Feel About Their Nursing Program in a Large Multiversity. I merely responded that other research projects came across my desk on university letterhead, so I was just following protocol, okay? So I must give those faculty members at that university all the credit for my deciding to go to Northwestern University to get my PhD, because the back of my mind I said, if they can do it, I know I can do it. So I didn't have too much respect for the whole, genre there. It was a good school. It's still a good school, but I hope that they have improved in the ways that they handle, take care of their minority faculty members. I hope so. And I really don't know what they're doing in schools of nursing now. You all will have to tell me. I can only tell you what I went through. Yeah. So communication is a critical component in planning and evaluation. I think we talked about that at the breakfast table this morning. Faculty members today plan their career advancement in what they term a career trajectory now. That's what the common buzzword is. This means that they develop a written plan for how and when they will achieve certain goals and objectives. Knowing where you want to be and when is critical to your survival in higher education or in any career you choose, you must be alert to communication innuendos, formal evaluations, and private discussions. In addition, you must always have an exit plan. Okay, you know what an exit plan is? Know when to leave. Okay, know when to fold them, right? All right. Another basic fact about communication is that you are not always privy to communication at all levels, so that you might not know who is saying what to whom about you. Just recognize it's going on. Another example, I had just finished teaching one of my classes when I was at Lewis. When I walked by the coordinator's office and heard the other black faculty member who had asked to sit in on my class tell the coordinator that I had left out some very important information, class content. Well, she hadn't stopped to tell me that first so I could improve, okay? I didn't, approach the faculty member, but from that point on, I knew I couldn't trust her. So that's where I was shocked and never spoke about it. My point is that you certainly don't want to be paranoid, but remember the little cat, right? But you do need to be careful to whom you confide certain information, even if it's another minority faculty member. Be smart, okay? It's called being savvy. So let's talk about methods of communication. There's written communication, and I think we discussed that a lot, but you should always be aware of what's in your personnel file. This is what we talked about this morning. My husband is a locally elected official. He doesn't like the word politician. He says every black elected official has an FBI file immediately once they're elected. Did you know that? We do. Yeah, we get one. So, but always in higher education, always know what's in your file, and that's your right to know what's in your file. I can remember I sent an application to the University of Illinois, and one of the clerks in Human Resources called and said, Dr. Allen, I wasn't a doctor, Miss Allen, do you know that this school is sending in bad evaluations on you? One of the other schools, which I had a smart mouth on. And she was a little concerned. I said, yeah, that's okay. Do you want to see it? No, I don't necessarily want to see it. But I was hired anyway with another smart mouth. But anyway, that it will follow you. So I make a joke out of it, but you stand up for yourself, but in a way that does not, bespeak negative things about you. So be kind of smart about what you say to people. Oral communication is what is being said, and important because it has devastating results, because oral communication is not always positive, it's not always truthful. So that's the bad thing about oral communication. It's hard to find out who's saying what. Behavioral communication is body language and can contradict oral communication. So when you're talking to people, beware that you're listening to what they're saying, but you're also looking at their behavioral attitudes. Eye rolling, twitching of the head, turning away, and not actually listening to you. Those are all signs that you're not making a dent with this person. Now, I like this one about subversive communication. It's communication that is hidden but causes great harm to your reputation and career. Okay, a good example was the faculty member not talking to me. Trying to see. I won't read that. No, I don't want to come off too bad. I'll go to the part I like best in this speech, and that's responsibilities associated with communication. And I think it's one of the most important parts of communication. And the one that I have always liked in my career is helping other black faculty members to succeed. Okay, I founded the Association of Black Nursing Faculty, and it's sort of been my life's work. I graduated from Northwestern in 1986. When my daughter graduated from college, we graduated the same year. And part of my dissertation was locating all the black faculty members in the state of Illinois, President Obama's home state. I had to throw that out. And I located all 42 of them out of the state of Illinois. And 21, I invited 21 showed up at my house from brunch. I had a brunch for them. And they decided to form a national group, the Association of Black Nursing in Higher Education. So when I went to Bradley University, and that's where I met Patty Humbles. Is Patty here? She's one of my graduate students. Okay, yeah, so she found her way to California. Okay, and that's also Richard Pryor, that's his hometown. But anyway, I was the graduate coordinator for developing that master's program in nursing administration at Bradley. And one of the things about I skipped a page, I'm sorry. And so literally hundreds of black faculty have passed through the Association of Black Nursing faculty. And what we do is we mentor them, we tell them pretty much what I told you today, how to survive and thrive in higher education, because these are the things that you have to do, things that you have to know. It doesn't always help you, because we have someone here today who's gone through it, so I really don't know whether things have changed that much in terms of are they being truthful and honest with black faculty members or minority faculty members in terms of their evaluations, what you do. We tell you, I founded also the Tucker Publications, you might know that, and I did that because when I founded the Association of Black Nursing Faculty, I knew we needed a journal. And when I approached the publishing houses, they said they weren't interested. And so I said, well, how hard could it be to start a publishing company? Naivete is okay sometimes, you know. And so I founded the company, Tucker Publications, to publish the ABNF journal. And so this is how we got into publishing. It's great because, I'm going to skip ahead, we don't have much time. When I was teaching, research on minority clients was not recognized as valid research. You could research minority students, you could research sickle cell anemia. It was not considered valid research. You got no credit for that towards tenure. The only time you got credit was when the federal government started giving money for minority health issues. Then all of a sudden things swung away, and then it became acceptable research. Now you can see who controls this environment. Money talks. Okay? So now they're doing research with us and blah, blah, blah. But that's how it changed. Before, we could not get any credit for that. Okay. Now, the symbol of ABNF, if you've ever seen the journal, is the flame. Have you seen the flame? The flame represents the biblical verse, "Let your light so shine that others may see your good works and glorify your Father, which is in heaven." The reason that the flame was selected was because, based on my experiences, black faculty members do not take credit for the work that they do. And I always tell them that being humble will get you into heaven, but it won't do anything for you in higher education. You have got to learn, and I'm going to tell all of you here, to toot your own horn in a very nice way. Don't have a smart mouth like me. Okay. It sounds easy, but it's not easy, you know. But if you look at other people and see what they do, what we do, whatever, like you have presented somewhere. Okay, I publish also the Minority Nurse newsletter. In fact, we have student members in the Association of Black Nursing Faculty. If anybody wants to join, it's $25 a year. Okay. Whenever you do something, give a presentation, poster, or oral, then you send that information to us, and usually it's to me. We can put it on a Minority Nurse newsletter, or we can put it on announcements in the journal. That's letting other people know what you're doing and getting your name out there. Okay, so that's what we do. We teach you how to toot your horn in a professional manner. All right, okay. And I'm also updating the Directory of Minority Nursing Faculty, and I made the mistake, my light mouth is right, mistake of not bringing the data forms to give to the faculty members here so that you can decide whether or not you want to, your name included in the Directory of Minority Nursing Faculty. Okay. I do need that. Thank you. Thanks. Excuse me. The purpose of the Directory of Minority Nursing Faculty is, in schools of nursing purchased across the country and in the world really, it gives an idea of what you're doing and what your research interests are, your teaching interest areas, your credentials, what you've done, to those who might be looking. This is a time of year when I know Dr. Evans-Manley don't want me talking about people looking for other faculty members. Well, this is the time when other schools are looking for other faculty members, and does give them an idea of where you're located. Okay. Now, when I did my first research, in order to take this organization national, I had to survey all of deans of schools of nursing in the United States. And that was in 1987. There were only 608 of us out of 19,000 nursing faculty members. Now, graduate students are doing similar research, and they call me, and they said, Dr. Tucker Allen, the number of minority students in schools of nursing is decreasing, okay? And say, what is happening? If students continue to decrease in these programs, our faculty numbers are still going to decrease, okay? So I'm doing the survey now in terms of updating the Director of Minority Nursing faculty, so I should have some data by January in terms of comparing with the 1987 data, and then I'll have something to write about, okay? Isolation can be brutal. Nobody enjoys working by themselves, but maybe things have changed since I was an instructor of nursing. Maybe even white faculty members are writing articles with black faculty members, and I really think that's happening. And so I'm really pleased by that. I said the last one is administration and staff. Administrators are the ones who do the hiring and firing of personnel. And there are levels of administrators that you should always know in your institutions or wherever you are. Most schools of nursing are organized in a manner usually developed by the dean and the faculty, although I worked at schools of nursing where students' committees take care of student problems. A lot of schools are on the honor system, and so it doesn't come to an administrator. It stays with the students who work out the problem. So you really have to know the organizational structure of the schools where you work. Staff are important too, because staff can stop you from seeing the department head or the dean or the provost. So you don't go in with an attitude when you're trying to get somebody to help you. Okay, and if you're nice, they usually treat you nice and befriend you. Lessons that I have learned. In 26 years, I've worked with the Association of Black Nursing Faculty. There have been many challenges. We've had faculty, and we come in, we help them, they go. The only thing that we ask of them is that they mentor other black faculty members. In this case, we're moving to a minority nursing faculty members. You mentor somebody behind you so that you're always giving to rather than just taking. You know, I used to, okay, we did that. Well, first goal, we had a first goal, okay. Okay, so Tucker Publications was founded in 1988, and we've published several books. One is the Director of Black Nursing Faculty. We changed it to Director of Minority Nursing Faculty. Then we have a book, Recruitment and Retention of Minority Nursing Students. We have one written by Colonel Bailey, first black nurse promoted to colonel in the United States Army Nurse Corps. It's called The Challenge. She's still living. Then we have the textbook Theory, Construction, and Testing. And for the last 2 minutes, I'll tell you about this book. And that's the book that I gave you as a gift for attending the conference. Dr. Margaret Beard was our theoretician. She knew it, I don't. She really knew it, you know, backwards and forwards. So at one conference, she said, Sally, I'm teaching this course, Theory, Construction, and Testing, but I don't like the textbooks that are on the market. Do you think Tucker Pub would publish my textbook? And what she did was she took her class notes, developed that book that you have in your packet, and we figured out how many students she had in her classes and how many books she would need for the next 5 years. And that's the number that I had printed and, for her classes. When she went back to school, we had the meeting in June. When she went back to school that fall, she was told by her dean at Texas Woman's University that she would no longer be teaching that course. They took the course from her. Do you hear me? It's not funny, but I'm saying this is how academia works. The dean knew she had that book. She knew that she had a number published for the next 5 or 10 years. She took the class from her. That was my little thing, okay. We have other journals that we publish. It's not the Journal of Multicultural Nurse. That is another journal, but I don't publish it. I publish the Journal of Cultural Diversity, which is an interdisciplinary journal. So, education, physical therapy, anybody can write for that journal. I do encourage you to write to me. My email address is drsallie@tuckerpub.com, and let me know if you want to serve on editorial review boards, if you have an idea for a paper. I can send it out to any of the faculty members who belong to your organization. They can look at it. They love to help you. You know, they won't write your papers for you in undergrad school, okay? But if you got something that an idea that you want, they will help you. All right. And if you want grants for the faculty member, we have faculty members who write $1 million, $2 million, $3 grants. They sit on the board of reviews for grants. So we're a resource organization, and we're trying to help you stay in an occupation that you really want to stay in. If you don't want to stay, you know, you can come in and see what it's like. And if you don't like it, you can find something else. But teaching really is a great field because you have the opportunity to work with students, you know, to make sure that they're well grounded in the professional concepts. I hope I haven't bored you too much. Okay? But thank you so much for coming. Oh,